Hi everyone and welcome. My name's Elle and I'm from the Lucy Rose Clinic. And today I'm going to be talking about something a little different on the live. So today I'm talking about men because thyroid issues are not just a woman's health problem. They absolutely do affect men too. And men are just not getting diagnosed. So if you're a man watching this, if you know a man, whether it be your partner, son or dad, if he seems exhausted, can't think straight, has lost his drive or motivation, then this live is definitely for you. So please continue to listen, because the answer is probably not just getting older, and it's probably not just stress. There might be something very specific going on that is testable and it's treatable. So here's why men fly under the radar when it comes to thyroid health. Thyroid conditions are statistically more common in women. So actually about 8 times more common. So when you go to the doctor, doctors are kind of conditioned to think thyroid when a woman walks in and to think stress, depression or age when a man does. And that men will present differently. They're less likely to speak up about their symptoms. They'll just push through. And the symptoms of low thyroid in men, which is fatigue, brain fog, low motivation, weight gain, low libido, are easy to dismiss as a lifestyle issue. But here's what we should know. The male thyroid is just as critical to health as the female thyroid. So thyroid hormones regulate every cell in your body, and that's men included. Energy production, testosterone conversion, cholesterol metabolism, cognitive function. All of this depends on adequate thyroid hormone. Low T3, the active thyroid hormone in men, directly affects testosterone production. So the two hormones work together. So low thyroid often means low testosterone, and then they compound each other. Okay, so that's really important to know. And if it's hitting home, either for yourself or someone you know, please drop a comment below. I'd love to hear from the men watching too. Are these symptoms you're experiencing? Have you been told it's just getting older or being dismissed? And have a chat in the chat box. It's a good place to talk. So let's talk about what actually drives thyroid dysfunction. This is in men specifically. Iodine deficiency is one of the most common and most overlooked factors. So men are not exempt from this. In fact, because men often don't take supplements, don't eat as many iodine-rich foods like seaweed or quality dairy, they aren't screened for pregnancy the way women are. They often have low iodine status without ever knowing or checking. So iodine is primary building block of thyroid hormone, and without it, the thyroid literally cannot make T3 or T4. Selenium is another one. So that's critical for converting T4 into active T3. And Australian soils are notoriously selenium depleted, meaning the food grown here is lower in selenium than you'd expect. And then there's the lifestyle picture. So, for example, chronic stress, that drives up cortisol, which blocks thyroid function. Poor sleep suppresses T3. High alcohol intake stresses your liver. And your liver and gut are where T4 and T3 conversion happens. So all of these things come together, and for a lot of men, the picture is a combination of, low-grade thyroid dysfunction that's been there for years, compounded by lifestyle and nutrient factors, and never once investigated, which is, it's crazy because it can be fixed. Here's what I'd encourage any man watching or partner of a man watching, this is what I recommend. So step 1, ask for a full thyroid panel, not just TSH, request free T3, free T4 and thyroid antibodies. 2, consider getting iodine and selenium levels assessed. This is a simple urine and blood test, and they tell us a huge amount. Number 3 would be look honestly at sleep, alcohol and stress. No judgment, but these things are directly impacting your hormone function. So it's definitely something to look at. And number 4, don't accept it's just your age. It's, as a 42-year-old man, you should not be exhausted all day, every day. It's not normal. It's not common. So definitely don't shrug it off. So at the Lucy Rose Clinic, we see men regularly and we take a comprehensive approach: thyroid, adrenals, nutrients, lifestyle, all together. And if you're done with feeling flat, foggy and exhausted, please come in and have a proper conversation with us. All right, so the link is in the comments below. Share this with the man in your life who needs to hear it. You might be doing him the biggest favor over his life. Once again, thanks for being here. I love talking to you guys.